Stem cell therapy for knees. Say goodbye to pain. This is Josh with Dream Body Clinic, and we're going to talk about the stem cell knee treatment today. This is the most common treatment that we do here at Dream Body Clinic. Been doing stem cells for almost over 8 years now, helping tons of people, and it seems like everybody's knees go out at some point. Now, the most common things that we see are arthritis, so lack of cartilage, meniscus tears, and ligament tears like the ACL, the MCL, the PCL. As long as it's not a complete tear, we can usually fix it up. We see a lot of patella arthritis, we see inflammation, Baker's cysts, which are a reaction to chronic inflammation. We're able to get rid of those. And I've personally dealt with some of these issues. The first treatment I ever did, and I was patient number one because I don't offer things that I don't do myself, were my knees. And my right knee, when we did the MRI, I had multiple meniscus tears and a partially torn ACL. So we did the injection, very simple, right into the knee. We put 50 million stem cells in there and they start seeking out inflammation. They're gonna find what's wrong. They're smart like that. We don't fully understand how they know that, but there's a big just messaging system going on throughout the body, cells communicating. And that's how these types of cells work. Mesenchymal stem cells work via what's called the paracrine effect. It's the signals they send out that start guiding the repair process. Think of them like the manager on the construction site. They're telling the workers what to do, where to go, and the first thing they do is start getting rid of scar tissue. So anytime you have an injury, the problem is with your body, the older you get, you have fewer and fewer of these mesenchymal stem cells in your body naturally. So white blood cells rush to the area and they can only heal via fibrosis, that's scar tissue. So what happens is they patch it up with this scar tissue, and now the growth factors that are naturally occurring in the plasma in your blood get there, they want to help, they want to heal, but they can't. They can't get past that scar tissue. The mesenchymal stem cells get in there and they start sending workers to start getting rid of that scar tissue. Then they start regenerating that tissue. If it's cartilage, they're going to recruit chondrocytes, which are the building blocks of cartilage, start building that back. So arthritis is the most common thing we treat, and it can be the easiest or the toughest. It depends how long you wait. Most people wait too long, and when they come to us, they're like 3rd or 4th degree arthritis. Well, 4th degree arthritis is what is commonly called bone on bone. You'll have a lot of people go to like their doctor in the US, Canada, UK, or Europe. They'll do an x-ray and they'll say, oh, you're bone on bone. Now, you don't always want to believe that. An x-ray is not a good way to assess cartilage, actually. You can infer how much cartilage is there by this space between the bones, but the problem is they can angle that x-ray from any way, and they usually only do one shot. You could make anyone look bone on bone just by changing the angle of that x-ray. So an MRI, magnetic resonance like we do, that's going to show all of the soft tissue and the bone. You're going to see cartilage, you're going to see ligaments, tendons, meniscus, all of these tissues, and any sort of areas that are inflamed tend to fill up with synovial fluid. They show up bright white on the MRI, and you can tell where the damage is. So the stem cells get in there. So for stage 1 or stage 2 arthritis, we can usually fix it up one and done. Now, when you get to stage 3 or stage 4, it gets more difficult. I've seen some patients get from stage 3 to 100%, but most of them require a follow-up treatment, maybe like a year later, to get over the top, because you can always do more cells. You know, any treatment, you're going to get some sort of benefit usually, and you can always build on that if you don't get all the way. So for like stage 1 or stage 2 arthritis, like an 80% success rate. Those people, it's almost always one and done, good to go. And for stage 3, that percentage drops. It's a lower percentage, and at stage 4, it's kind of a 50-50. We've seen it work, but best case scenario at stage 4 is you're going to get to stage 3 or stage 2. Stage 3, we can usually get you to stage 2 or stage 1, where if you're the first 2 stages of arthritis, it's just kicking in. Usually it's one and done. So at 80% of people, one and done success. 15% of people, they'll see results, but maybe not 100%. But any reduction in inflammation and damage makes a huge difference in how it feels, your pain levels, mobility, all of these things. So very effective. And then there's usually about 5% of people that just don't respond. That's just medicine. We see that across the board with stem cell therapies. There's a small percentage of people just don't see results. These same stats apply to meniscus damage, to ligament or tendon issues, and very, very effective. I had a partial ACL tear. You can see my before and after MRIs there at the website at www.dreambody.clinic. Scroll down on the homepage, you'll see all the treatments. Click on the knee treatment. You'll see a bunch of before and after MRIs, patient testimonials. There's videos comparing, showing the benefit people have had from this, and it's highly effective. All the info and prices are there. I mean, everything you could want to find in regards to this treatment is listed out, because I hate it when you go to a website and you can't get real info, real prices. We don't do that. Everything's there, as transparent as possible. We do everything above and beyond what would be required if we were in the US, because we're here in Mexico. But look, I'm American, I know what people expect. So we've gone out of our way to make the clinic far above and beyond what you would expect in the United States. We quadruple check everything with the cells. We provide third-party analysis, plus we do our own analysis of the cells to make sure you're getting perfect isolated mesenchymal stem cells. We can test that via the surface markers, the phenotypes of the cells with flow cytometry. We use cell counters to check the viability, the number of cells, all of that. I mean, everything's checked all the way through, and that's what makes it so safe. And these are safe because mesenchymal stem cells lack what's called HLA, human leukocyte antigen. That's the marker that tells you it's from your body. So it's like your fingerprint. Because we're taking these cells from umbilical cord tissue called Wharton jelly, placenta from another person, you would think, oh, it could be rejected or it'd be DNA transfer. But those things don't happen because the HLA is not exhibited, so they don't differentiate. They get in your body and they start acting like that manager, and your immune system leaves them alone because they're not telling your body that, hey, these are from someone else. Eventually, usually 8 months to a year after, they will differentiate. At that point, your immune system will recognize them, attack, wipe them out, they're done. And that's why the furthest out we've ever seen major improvement has been 9 months post-treatment. We typically see peak results 3 to 6 months. I wish it was instant, but tissue regeneration takes time. So you come in, we do blood work, do an MRI, review it with the doctors the next day. We explain it all. It's not like in the US where a doctor just gives you some basic generic info. No, our doctor is going to sit with you, explain it all, make sure you understand it in depth, thorough. You can watch our series DBC Diaries on the website. If you go to YouTube, search that or search Dream Body Clinic, you can see exactly what it entails and how a process goes. Lots of patient testimonials there. I think we just filmed like episode 55, so we have a lot of those, and lots of other testimonials. So the treatment, so day 1, arrive and rest, day 2, blood work and MRIs, day 3, review, day 4, treatment. It is the quickest, easiest injection into the knee. We don't have to numb it. We don't have to do anything like that. In fact, injecting lidocaine or procaine really stings at first and then it numbs. So we don't want to do that. It's a really easy injection, goes in, you feel a little bit of pressure as the liquid goes in, and that's it. It's over before you can even think about it. And then you walk out of the clinic. There's no downtime, none of that. Now look, it's not instant. We do recommend patients take like 6 weeks of downtime, no major lower body exercise, meaning don't go running, don't hit the gym, heavy weights. We're gonna do 2 weeks of nothing major, then 4 weeks of a light rehab protocol that we recommend. And this is because we want the cells to target what's inflamed and damaged when you're not like inflaming it. You're not working out, causing more inflammation. We want them to hone in on those areas that are constantly inflamed, get to work, they're gonna reduce that inflammation, start fixing things. And then at 6 weeks, they usually have calmed it down quite a bit. A lot of people are feeling a lot better by then. And then we want you to go do some exercise, go for a run, play some tennis, go to the gym, whatever your favorite thing is. Bring back some inflammation, because that's gonna keep the cells in the area and keep things going. And hopefully, like it was for me, at 3 months, it just stopped hurting. It's never hurt again. Other people can take a little bit longer, could take up to 6 months, but that's the time frame, and it just feels like magic. You're like, it doesn't hurt anymore, just done. And that's what we've seen, helping so many people. So if you'd like to learn more about stem cell therapy, you can check out the website, www.dreambody.clinic. Scroll down on the homepage, you'll see all the treatments listed. Click through there, it's got all the info, prices, links to studies, testimonials, or you can call us toll-free, 888-704-3977. I'm Josh, happy to help.